I want you guys to think back to, say, 100 years ago. If you were sitting in a room like this having dialogue, how different it would be, right? So see if you can transport yourself. Because what I saw there and the discussion, there's so much technology, and it's almost like it's, it's not challenging to you. Just think about our predecessors, seeing cases like these, how challenged they were to actually just diagnose what it is they're going to treat, and to see patients of the patients that they try to treat either not recover as well or not even sure how the outcome is going to be. And we were worried about hospital stay. Just think about the hospital stay back then. So if we can do that, one of the things you will realize is, as a surgeon, each day was a challenge for you. It's a challenge of problem solving. And I think today we may lose that. So what I want to do is then to actually to transport yourself into the future. And in the future, what are you going to do? What is going to be your emotional state when you see a patient? Well, as you're doing that right now, I want to challenge you to see where you fit in. And that's where my talk is on. I've already gone through that, where I was on the path that was laid out. You go to medical school, you get trained, you go to an academic center, and you're publishing, you're asking questions, and you're trying to do better by your patients. But then I realized that as a physician, we generate all the revenues. But our portion of the system is tiny, because the rest of it is actually a business. And that's a lot different from 100 years ago, because the business side wasn't that well developed. And maybe I should use 200 years ago. Today, hospital systems are business. They were not invented for that. And it's a US phenomenon. It's not the rest of the world. So in the future, the hospital system is going to become more and more powerful. You, as a provider, will not. So that's either a decision you're comfortable with, or it's a decision you're not comfortable with. So what I'm going to do is talking about the history of how neurosurgeons and spine surgeons have been actually the one investing in advancing care. And now the business side is the powerful driver of actually how we deliver care. Because in this hospital, I walked through this beautiful hospital, and I don't know how many of you are owners in this hospital. And I'm always fascinated by Bill Gates and what he did with Microsoft here. And if this were Microsoft, being an engineer at Microsoft meant that you have to do a few things. One, you have to know what else is going on in the world. You have to also invest in the next generation of technologies. So every day you're challenged to compete, to get better. And the company is driven by its consumers, right? In this hospital, if you're not part of that business side, the consumer experience is not part of your experience, except how you treat that patient. Well, if I were to drive up here as a consumer, I would like to get valet parked. I want all the trappings of what I would get if I went to a restaurant or anything else like that. The problem is, if the system is set up where you as a provider is not part of that decision making, then it's not a true consumer-driven system, because you're delivering a product and you're not part of the business that determine how the product is delivered at its best. So I am interested in how we can change that for the future. Now, I'm going to start with an article by Robin Young. And it says, "When no good deed went unpunished, the first decade." And this was focused on a true pioneer, someone who decided at the time that they were going to act like a surgeon 100 years ago and actually identify a problem and is going to solve it. So Dr. Art Steffi not only identified the problem of how do you fix the spine, but decided he's going to start a company around that idea. Okay? And so in 1983 or 82, he partnered with a local businessman to start Axiomed. And it was based on a pedicle screw system, which we use today. Now, when he developed this system and he applied it to patients, the results were immediate. Over 50% of the patients he operated on, he was able to cut the hospital stay by, he was able to cut the hospital stay by 50% on these patients. That's a big change, big difference. That's a consumer experience that's immediately changed by a surgeon. He then tried to get FDA clearance, and he couldn't get it for spine application. They gave it to him for fractures, bone application. But he persisted, and he used it off-label. Now, as he did that, surgeons started to see the benefits of this, and they started to use it, and it started to spread. But the FDA was not ready for this. And so when the 2020 program aired the story of a surgeon or surgeons putting pedicle screws in the spine, it was thought to be something unscrupulous. And imagine a surgeon running a spine company at that and actually making a profit. So everyone who was involved in pedicle screw at the time got sued, even the societies, because this was seen as so outside what doctors should be doing. So Axiomed ended up settling the case for $100 million worth of lawsuits. And later on, the FDA decided to look into it even further. They were accused of making a profit, and that was a big deal. Now, here's what he developed, as you probably already know, is to develop a screw for the pedicle and plates. Now, because of the lawsuits, he sold the company. So he sold the company. They were doing over $100 million in revenues. He sold it for $325 million, and he got out of the business. It was bought by DePuy. DePuy kept going with this company and sold it for $3.5 billion. Okay? You guys know the story of Yahoo trying to buy Google, Yahoo trying to buy Facebook, and they held on, and now they're valued at tremendous. As a result of what he did, the business of spine was actually born. It changed everything. So now it's a business for everyone else, and I'm not sure what happened with surgeons after that, because that was a scary thing, to be going through lawsuits and being accused of unscrupulous behavior and trying to make a profit. So sophomore Danik came out of this. Guys at Tetra Scottish Rite Hospital came up with a system, pedicle screw fixation. They built a company called Danik, then merged with Sophomore, and Medtronic bought a company for $3.6 billion. It's a huge sale. That was in 1999. So Medtronic is not a spine company. They bought one, and so they're in the business of spine. Now, Medtronic in the early years was the giant. They still are. And so they would look at your idea, they would take it and they'd develop it. And Dr. Carlin is a pioneer in developing instruments and developing ideas and devices, and sued Medtronic and won $1.35 billion. So he's a surgeon. He was developing the ideas. Now, other surgeons along the way have started companies. Dr. Hyder, who I know very well, I know his son also very well, started C-Spine and built that company up and sold it for $89 million to Integra Spine. K2M, Dr. Kostwick was at Hopkins, decided to start a company, and K2M is now a public company. They received about $500 million in private equity fund, and he's building that company. I want to talk to you about other pioneers who 100 years ago was looking at problems every day and trying to figure out how to solve it. Dr. Harman, in 1952, implanted spheres in the disc space. And the idea was to treat degenerative disc disease anteriorly and maintain motion. That idea was a problem for him because he was vilified about it, doing this kind of surgery. And he actually had to leave the country. He then came back to California and practiced again, then started doing fusions anteriorly. That was way back in 1962. But Dr. Fernstrom was inspired by that and came up with the Fernstrom ball. And it was rumored that John F. Kennedy had that surgery. Never started a company and built it, but that innovation for him was real. He was seeing a problem and trying to solve it. Now, the idea of a Fernstrom ball was then applied in the cervical spine. So when you're a surgeon back then and you see a problem, whatever technology was available, you try to use it and you try to expand to solve your problem that you're facing. These are patients you're seeing. You didn't have the big business machinery separating you. These were things you could do. And you could argue, well, the FDA was important later on to help regulate that, and I agree with that as well. But the idea is if 100 years ago, if you're sitting here, you actually had real problems you have to go back and solve for real patients. You're not just part of a business. Well, Dr. Fernstrom had a lot of resistance, and a lot of that came from other surgeons, which is not unusual. And so, but when you look at terms like the rape of the spine and inflammatory rhetoric, when you're trying to innovate, that's some of the hurdles you have to get over. You're outside the norm. Well, back then, it actually was the norm to innovate. It's just as we move to recent times that we start getting more criticism if you're a surgeon and you're trying to innovate. Now, because of the Fernstrom ball and because of that work, there has been an evolution in disc replacement as a solution. And as you see, most famous is the Charité disc. But most recently, that evolution has continued to where we have a viscoelastic disc replacement in Axiomed, which is a company I own. But part of that solution of anterior surgeon led to the BAK cage. And I know Dr. Bagby, actually, I bought all of his patents on the new improved BAK cage, and he actually has shares in Spine Frontier, another company I own. But this work is an evolution, and you know what LT cage, and you see standalone cage, all those things are from innovation by surgeons to solve problems at a time when they actually were closer to the patient and felt more invested in what they did every day. Well, this company was ultimately bought by Zimmer for about $600 million. Dr. Mark Riley looked at a problem of vertebral fractures and built a company around an innovative solution. And Kyphon was later bought by Medtronic for $3.9 billion. And I know Dr. Mark Riley. I've talked to him about his new company, SI Bone. I also knew him when he started Arcus, which is a facet replacement company. So he's a surgeon that is solving a problem and turned it into a company. Spinology was started by Dr. Kuslik to also address the issue of vertebral body fractures. Now it's been used for inner body fixation because it goes in small, it expands, which is a true solution. Zuckerman and Sue developed the X-stop for solving spinal stenosis in patients that had quite a bit of comorbidities. They sold that company to Kaifon for $525 million. They were doing $30 million in revenues. Healthcare services. Surgeons have been involved in starting hospitals, been involved in starting institutes like the Texas Back Institute. Dr. Roshbaum trained with Dr. Bowman. Long before I trained with him. And Dr. Bowman would tell me the story that he said he was going to go to Texas and start his own institute. Dr. Bowman wanted all of us to go into academics. He wasn't happy about that. He couldn't visualize what Dr. Roshbaum saw. And I was just about 2 months ago having dinner with Rick Garr in Dallas discussing the Axiomed disc, and he talked about all this experience. But they built their own institute, which means that they're tied to the entire delivery process of care to the patient. Digital health. Spine surgeons have been involved in digital health. 1999, when the internet was booming and still young, Dr. Adelson in Florida started Spine Universe. And I used to be one of the editors there. Many surgeons he would invite to write an editorial. He developed the content. And that was the precursor to things like Facebook, because basically he didn't have to make anything. It was just content. Just get surgeons to write content and run a company. He just didn't take that to the next level as a business. Health Grades, WebMD, ZocDoc, other business people have come in, but he had that was visionary for him to develop that. Spine Connect. I know Yusuf, I know Dr. Brodke, and I know Jeff Wang very well. And they came up with a way to leverage digital health to connect doctors together. You could share your cases. You could have groups. It's a pioneering idea back in 2006. They just weren't able to develop into a business. And so that's a great platform that wasn't fully leveraged. I think the difference between what we're seeing here and in the past with like an Axiomed, Dr. Steffi, is how we approach solutions as surgeons. Do we approach it just from a pure academic sense, or do we approach it from a business sense? Do we want to take an idea like this and actually make it into a business? And that's where I am. Where are we today? Well, here is a typical surgeon who today leave here and goes out. Real estate. First thing we want to do, own a piece of real estate. We've been deferring our gratification all this time, living in medical school dorms, college dorms. We want to own a piece of real estate. We want to own our home, right? Nothing wrong with that. So real estate is comfortable for us. We're going to own that, and we're going to start with our own home, maybe an apartment, then a house. As we're making more money, buy a bigger house. We have more family. That's what we do. 401k. Maybe we're working for a hospital. Maybe we're working somewhere that has one of those. Great if they match it. We're going to focus on that. Mutual funds. We get a little bolder. We want to put away some money in investment. We don't have the time to go into the stock market, so we give it to someone else to invest it for us, and we choose, low, medium, high risk, and we don't have to think about it. We're expecting it's going to make money for us. Life insurance. We're a great target for financial planners. Tell us about life insurance. Or you can get annuities. You can get a fixed rate, 7%. You can borrow against it, all that stuff. So we put our money there. Some of us are bold enough. We have extra time. We actually enjoy playing the stock market. We also enjoy going to Vegas. All those things feed that challenge for us. So we play the stock market. All these things we do. If you look at that pie, a pot of money that we have, you start dividing up among all those, you can see there's not much left over for you to actually be a player on the business side of healthcare. Well, should surgeons invest directly in healthcare? Well, here's why you should. It's a powerful long-term trend. Any country, as soon as they start getting more money, the first thing their citizens want is better healthcare. The next is education, right? Healthcare is non-discretionary. You will get a premium if you have money, and you may bitch when they increase it, but you're still going to get your insurance. You're going to spend your money. So, and if you look at the future of healthcare, there are more people who want to live longer, who want to do more things. That's a perfect setup for an area to invest in. Well, if you look at all the technologies that's emerging out there, one that's clear is smartphone. Mobile technology, every single person going to have that in their hands. Your patients will have that in their hands. Your patients are not just going to go look up in the yellow page anymore or just search on the internet to find you. They're going to actually want to consume digital health information online long before they come to you. You have to be ready for that. And if you look at a lot of the companies that are overnight success, they don't own anything. Uber does not own a single car. Pinterest doesn't own anything. They aggregate users and they leverage that. So information is going to be key, and getting people to consume that as value, right? You have information, it's your medical knowledge. It's tremendously valuable. But how do you monetize that? Outpatient. We're in a beautiful hospital here, but at the end of the day, when you leave this room and you go to operate, you go to a room with an operating room table in there, lights and all that. That could be anywhere. That could be anywhere. It doesn't have to be in this beautiful building. So outpatient is real. I hear the difference between endoscopic approach to the C2 versus posterior approach versus through the mouth, all that stuff. Well, when the patient's going to make that decision, I guarantee you they're going to go to the surgeon that's going to be outpatient. That's real. Plastic surgeons know that. I don't know how many plastic surgeons today want to operate in a hospital. They go to surgery center. There are over 7,000 surgery centers, more than hospitals now, and growing. So what I contend is investing in healthcare is investing in what we all consume. Every one of us in this room is a patient. It's a guarantee that you're going to see a doctor. So you are a patient. So if you think Facebook is big, consider a company that connects every single person on the face of the earth through healthcare, because you have to utilize healthcare. That's what we want to do. Here's why. Because surgeons drive the entire system. All the money that's coming into the hospital, all the money that's coming into the system, you're driving that. Okay? Over $1 trillion in just a hospital. The premiums for insurance companies, over $650 billion. The revenues from medical devices that you're making, over $150 billion. We put those in. So in 2005, I was still at UPenn. I started a fund. Invested in the percutaneous pedicle screw system called the Mantis, minimal access, non-traumatic insertion system. And I sold it to Stryker Spine. And that money we used to capitalize the fund. And since that time, we've been organically building a healthcare system. Not interested in building one company or two companies. It's a full healthcare system. Here are a couple of the companies that are in that. I acquired Axiomed. This was a company started by Art Steffi, his first disc, the Acroflex disc, and he had trouble finding the material that would not delaminate and could be attached to the metal. But he understood something clearly. When you look at the Fernstrom ball, it's not a true disc replacement. He wanted a true disc replacement, which was viscoelastic, just acting compression. Today, we have disc replacement that are ball and socket joints. That's not a disc replacement. So this is what we do. We own this. disc, and here's the original idea, and from that, the Freedom disc was developed. They had about $85 million in funding. They ran into trouble with cash, and I went in and I bought the company. Here's Spine Frontier. After I sold the Mantis to Stryker, I decided surgeons are better at going back to being the ones developing all the implants. So I've been developing all the implants, and by the end of next year, we'll have every single device in spine surgery by any other company available to spine surgeons. I will continue to develop and lead what is it that you need to do any kind of surgery you need. We have to control that. The Less Institute. I believe that we should control the healthcare system. We should control the insurance company. We control where we do the surgeries. You should be in this room and this hospital is yours. That's what I believe. And so we're starting the Less Institute, and it's based on the Kaiser Permanente model. What's interesting about the Kaiser Permanente model is, I'm sure if I ask everyone in this room, and I'm not going to do it, who founded it, would you say Henry Kaiser? Sounds like right? Bears his name. Well, it was started by Dr. Sidney Garfield. He finished his training, like some of you fellows will, and he decided he's going to go on where the Colorado aqueduct was being made, because there are patients there. And he started seeing these patients, but there are all these accidents by all these workers. And he was broke. They couldn't afford to pay him. And he met someone who actually knew something about insurance, an engineer, and said, why don't you do a prepayment system? And he actually asked every worker to put a nickel a day. So now he has all the money. He's an insurance company, and he's a doctor. Now, when someone gets an injury, he's vested in what he delivers. He wants to overtreat, well, he's got to pay for that. He wants to undertreat, then his reputation on the line. He controls the entire customer experience. So that's what I want to do. So as he did that, Henry Kaiser, during that period of time, was in Oakland as an industrialist. He was building ships. He had people working for him. He liked the idea what Dr. Garfield was doing, so he went to him and said, I want to finance you to go bigger, but why don't you come to Oakland and work for me? That's what he did. Hence, Oakland is still where Kaiser Permanente is most dominant, and now they're spreading. They own about 39 hospitals now. Last year, they did about 150,000 surgeries. They grossed $60 billion in revenues, and the system is fully controlled. They don't own their products. They don't have a digital platform. Certain things are missing. But this is a case where a doctor started something that today, and that was in 1933, today is the model, I think, for how the system should actually work. Less Online is a digital platform we're starting, in which you can go and get all your information. We did a study looking at all the patients that came in to see me in my clinic. Over 75% of those patients didn't have to be there. I could give them an algorithm online that they could treat themselves. I could connect all the providers, MRI, X-ray, physical therapies, every single one of them online. They never have to come see me. Okay? We have put very little, if any, effort into the patient nutrition before we take them to surgery. Okay, I don't see anything on those reviews about the patient's condition before you do a big surgery on them. I see about how if we do the surgery, how long they'll be in the hospital. Well, that's influenced by what you do. So we want to invest, just like bodybuilders do, just like athletes do, in treating the patients as someone who's going to undergo surgery and is going to have metabolic challenges. We want to have a whole line of nutraceuticals to help us with our surgeons. This is a company I acquired in 2014 with Tesla and Google, the driverless car, the connected car. There are too many accidents happening to patients because they are using technologies inside the car that were not optimized for being used inside the car. So once I saw this technology, I jumped on it and acquired it. We recently had Samsung visit us from Korea because we have a proprietary display, and they're a large display company, and they want to use displays everywhere. So they've been looking at that with us. I'm actually flying to Sunnyvale and Palo Alto tomorrow. I have meetings later on today around this technology. So this is game-changing as to how, when you're inside a car, if you look at the Model X and Tesla, they basically have a tablet that's going to be what you use. Everything's going to be voice activated. The dashboard will no longer look like the current dashboard. It's around safety for me. And I don't just want to take care of patients who are injured. I want to be part of preventing that. And if I'm going to be part of preventing that, I want to start a business around that. And here is an OEM model. A lot of the car companies are talking to me about, can we get an OEM model, which means that they're going to put it inside their car. You're going to go in, put your phone inside a slot, the top is going to open up, as well as an aftermarket model, which you saw there. Every year, this is the third year, we have a Health Tech Venture Network Conference. Last year, 35 surgeons came there. This year, we'd like to see more surgeons there. And that is a place where you can go and start to talk about entrepreneurship. How are you going to change the system? How are you going to get into business? What are you going to do? And so I felt this was important. I got this idea when I went to CES 3 years ago, and I saw, over 100,000 people there and all this technology, and I realized, wow, there are no surgeons here. And so we want to do that so surgeons come there. LES Society just held a meeting this past weekend with surgeons there in Key Largo, where we're talking about how do we organize surgeons around advocacy about controlling our lives. You need a society that does that. None of the societies today really has the ability to do that. It's just too big, too bureaucratic. It's about going there, getting a CME, and there's lots of problems with that. Those societies were started at a different time. You need a different society today, and that's what this is. So it's my last slide. So in closing, what I'm suggesting is, if you look back to where we're coming from, it's not just the techniques, but our role with the patient. And 100 years ago, we didn't have a lot of this stuff between us and the delivery of the care. We need to find a way to get back to that, because if you don't, maybe 10 years' time, we're all employed by the business. And some of us will thrive in that environment. Some of us will be able to advocate from that platform, but most of us won't. Appreciate your time. Let me talk about this topic.